Let's start with one of the biggest myths that men over 50 often hear. If your prostate gets bigger, it means you have cancer. This is simply not true. The prostate is a small gland, about the size of a walnut, and as men age, it naturally tends to grow. Doctors call this benign prostatic hyperplasia, or BPH. The key word is benign, meaning it's not cancer. Almost every man over 50 will experience some degree of prostate enlargement, and it usually shows up as urinary changes, not as cancer. But because people confuse growth with danger, many men panic unnecessarily. The truth is, enlargement and cancer are two separate things. They can overlap, but one does not automatically mean the other. Now, another common myth is that prostate problems only happen to unhealthy men. You'd be surprised how many active, fit men come in with questions about their prostate. The reality is your genetics, your hormone balance, and simple aging play a bigger role than just how many push-ups you can do. You can be eating well, exercising, and still experience prostate changes. That doesn't mean you're failing at health. It just means your body is going through something that happens to almost all men if they live long enough. Here's a myth I hear over and over again. If my prostate is fine now, I'll never have a problem. Unfortunately, that's not how it works. Prostate issues don't give a warning decades in advance. They show up gradually. Your urine stream might slow down. You might feel like you didn't empty your bladder, or you might wake up more often at night. These are common signs of an aging prostate, not sudden illness. Waiting until things become severe is what causes trouble. The smartest thing you can do is simply be aware and proactive, not fearful. Another dangerous myth is tied to masculinity itself. Some men believe that if their prostate is weak, enlarged, or if they have to deal with prostate treatments, it somehow makes them less of a man. That is flat out false. Your masculinity is not defined by the size or condition of your prostate. I want to be clear on this because shame and silence are what keep men from seeking help early. Hormones like testosterone, lifestyle choices, and mental confidence are all connected. But a prostate condition does not reduce your worth as a man. That's a mindset we need to put to rest.
Let's also talk about the myth that prostate problems only show up with pain. The truth is, many prostate changes happen silently. You don't always get pain, burning, or blood. Sometimes the only signs are subtle, taking longer to start urinating, feeling like you need to go again right after finishing, or noticing a weaker stream. Men who wait for pain before paying attention usually come in much later when it takes more effort to fix things. Catching these subtle signs early is the smarter move. Here's another one. Frequent urination is always just old age. While it's true that an older bladder and prostate can change, frequent urination can also point to other issues, including diabetes or even infections. Brushing it off as just getting older is dangerous. The body gives clues, and ignoring them allows small problems to grow. Age plays a role, but it should never be the excuse to ignore your health. Some men also believe that once prostate changes begin, nothing can be done. That couldn't be further from the truth. In reality, there are many options, from lifestyle adjustments to medications, and in some cases, simple outpatient procedures. Modern medicine has come a long way. What was once a life-altering problem can now often be managed with small changes. The idea that you're powerless once your prostate starts acting up is one of the most damaging myths out there, and it robs men of their confidence. Now, here's one more myth to clear up. Prostate health is only about avoiding cancer. While cancer is an important concern, focusing only on that makes men blind to all the other aspects of prostate health. Quality of life, like how you sleep at night, how comfortable you are during the day, and how confident you feel in your relationships, matters as much. Prostate health is not only about surviving, it's about living well. So, what's the takeaway here? Many of the myths surrounding the prostate are rooted in fear, silence, and misinformation. The truth is, your prostate is like any other part of your body. It changes with age, but those changes don't automatically mean disaster. Enlargement doesn't always mean cancer. No symptoms doesn't always mean health. And having issues doesn't make you less of a man. What matters most is awareness, paying attention to your body, and seeking help when you notice changes. If you're a man over 50, I want you to remember this. Your prostate is not something to fear, but something to respect. Don't let myths cloud your judgment or stop you from living with confidence. Knowing the facts gives you power, the power to take action before problems grow bigger than they need to be. And in the next part, we're going to dig even deeper into lifestyle myths, because what you eat, how you move, and the habits you live by make a bigger difference than you probably think.
Now let's move into the lifestyle side of things, because this is where a lot of men get tricked by bad information. One of the most common myths I hear is that certain miracle foods or supplements can cure your prostate overnight. The truth is, there is no magic fruit, no single pill, and no instant fix. Yes, diet matters a lot, but it works through consistency, not miracles. For example, foods rich in lycopene like tomatoes or omega-3s from fish can support prostate health, but only if they're part of a long-term habit. Eating one bowl of tomatoes after 50 years of poor diet won't undo the past. It's about steady, daily choices that keep inflammation low and circulation strong. Another big myth is that drinking a lot of fluids will always help your prostate. Some men push themselves to drink huge amounts of water, thinking they're flushing the system. But too much fluid late in the day can actually make prostate symptoms worse because it increases nighttime urination. Balance is key. Staying hydrated is important, but spreading your fluids through the day and slowing down in the evening is the smarter approach. Overhydrating won't fix the prostate. It often just makes sleep worse. Here's a common belief I want to clear up. Only alcohol or caffeine irritates the prostate. While it's true that coffee, tea, beer, and spirits can sometimes make symptoms more noticeable, the real issue is how they affect the bladder. Alcohol and caffeine are both diuretics, which means they increase urine production and can make urgency or frequency worse. But they don't damage the prostate directly. The problem comes when men ignore how their body reacts. Some men can handle a morning coffee just fine, but struggle if they drink it late in the afternoon. So instead of blaming the prostate alone, it's about understanding how these drinks interact with your body's rhythm. Now let's tackle exercise. A dangerous myth many men believe is that too much movement will make symptoms worse. In reality, the opposite is true. Regular physical activity improves blood flow, helps regulate testosterone and other hormones, and reduces inflammation. Studies have shown that men who walk, stretch, or lift weights regularly have fewer urinary symptoms compared to those who are sedentary. The key is not avoiding exercise. It's choosing the right kind. Long hours of cycling on a narrow seat, for example, can sometimes irritate the prostate. But general fitness, walking, swimming, strength training, protects the prostate. Sitting still all day is what does the real harm.
Let's also talk about stress, because this is one of the most underestimated lifestyle factors. A lot of men over 50 don't realize that chronic stress raises cortisol, and high cortisol interferes with testosterone balance. That hormonal imbalance can worsen prostate symptoms over time. Some men believe stress has nothing to do with the prostate, but science says otherwise. Anxiety and tension cause the pelvic muscles to tighten, and that can make urination more difficult. This is why relaxation techniques, deep breathing, and even hobbies can actually improve prostate comfort. Managing stress isn't just for the mind. It directly supports prostate health. Here's another myth I hear. Urinary problems are always caused by the prostate. That's not true. Sometimes the bladder itself is the main issue. Other times, the problem can even be linked to medications like diuretics for blood pressure, or to conditions such as diabetes. Blaming every urinary symptom on the prostate is misleading. That's why self-diagnosing based on myths can be dangerous. A professional evaluation is the only way to know for sure. Now, many men also believe that if they cut back on sexual activity, they'll protect their prostate. But that's not how the body works. In fact, research suggests that regular ejaculation, whether through sex or masturbation, may help reduce the risk of prostate cancer by flushing out old fluids and reducing congestion in the gland. The myth that saving it up preserves the prostate has no scientific backing. What the prostate actually needs is circulation and function, not silence and shutdown. Another area filled with myths is supplements. You've probably seen ads for prostate support pills that promise life-changing results. While some ingredients like saw palmetto, zinc, and pumpkin seed extract may support prostate comfort in certain men, they are not cures. Supplements can play a role, but only as part of an overall lifestyle that includes healthy eating, exercise, and regular checkups. Believing a bottle alone will solve prostate issues is just another trap. Finally, let's look at one of the most damaging myths of all. If I make lifestyle changes now, it's too late. That is simply false. Yes, it's better to start early, but your body has an incredible ability to respond at any age. Improving your diet, staying active, cutting back on late-night fluids, and managing stress can all make a measurable difference, even in your 60s, 70s, or 80s. It's never too late to support your prostate. The sooner you start, the more comfortable and confident you'll feel in daily life. So, when it comes to lifestyle, here's what I want you to remember. There is no quick cure, no miracle food, and no need to give in to myths. The truth is simple but powerful. Balanced hydration, smart food choices, steady exercise, stress control, and consistent habits are what make the difference. And in the final part, we'll take on the medical myths, because there's a lot of fear and confusion about screening, treatment, and what really happens if you get diagnosed. Now let's move into one of the areas that creates the most fear and misunderstanding among men over 50, the medical side of prostate health. There are so many myths here, and unfortunately, these myths often keep men from getting the help they need at the right time. One of the biggest myths is that if you have urinary problems, you must have prostate cancer. This is absolutely not true. While difficulty urinating, weak stream, or frequent nighttime trips to the bathroom can be symptoms of an enlarged prostate, known as benign prostatic hyperplasia, or BPH, they are not the same thing as cancer. BPH is extremely common in older men. It happens because the prostate naturally grows as you age. It is not life-threatening, but it can affect quality of life. Cancer, on the other hand, is a separate condition. The myth that every urinary issue equals cancer creates unnecessary panic and makes some men avoid talking to their doctor altogether. Another myth I hear often is that if prostate cancer is diagnosed, treatment always leads to losing your manhood. This is one of the most damaging beliefs, and it has stopped countless men from getting checked. The reality is that treatment for prostate cancer has come a long way. Depending on the stage and type, sometimes no immediate treatment is even needed. Doctors may recommend active surveillance, which means monitoring the cancer closely without surgery or radiation. In other cases, when treatment is needed, techniques are much more refined than they were years ago. Yes, certain side effects are possible, but not every man loses control or function. Believing the worst-case scenario without learning the facts only adds fear where knowledge could bring confidence. There's also the myth that PSA testing is unnecessary and dangerous. PSA stands for prostate-specific antigen, which is a protein made by the prostate. A simple blood test can measure it. Some men believe the test itself is harmful or unreliable. But here's the truth. It's a tool, not a verdict. A high PSA does not automatically mean cancer, and a normal PSA does not mean everything is perfect. It's one piece of the puzzle, used alongside exams and sometimes imaging. Now let's clear up another misunderstanding. If I get diagnosed with prostate cancer, it's a death sentence. This could not be further from the truth. In fact, prostate cancer is one of the most treatable cancers when found early. Many men live long, full lives after diagnosis and treatment.
the survival rate for localized prostate cancer is extremely high. What matters most is not ignoring symptoms, not avoiding checkups, and not waiting until problems become severe. The fear of death often comes from confusing prostate cancer with other more aggressive cancers. But prostate cancer, especially when caught early, is very different. Another myth worth breaking is the idea that prostate surgery always leaves men incontinent. While it's true that urinary control can be affected in some cases, most men recover well after modern surgical techniques. The key is that every man is different, and outcomes depend on many factors: age, health, stage of disease, and surgical skill. Believing the myth that surgery always ruins life discourages men from even exploring treatment options that could save them. Let's also talk about medications, because here's a myth. If I start medication for my prostate, I'll be stuck on it forever. This isn't always true. Some men need medication long-term to relax the prostate muscle or shrink its size, but for others, lifestyle changes and careful monitoring may reduce or even replace the need for pills. The important thing is that medication is not a life sentence. It's a tool to improve comfort and protect health, used when and how it makes sense for your situation. Another widespread myth is that once you hit 50, nothing can be done to protect your prostate. This belief is harmful because it encourages men to give up. The truth is, prostate health can be managed and supported at every stage of life. Regular screenings, balanced diet, consistent activity, stress management, and prompt medical advice all make a difference. Science shows that even in your 70s or 80s, positive changes still benefit the prostate and overall well-being. It is never too late to take action. One more dangerous myth is the idea that if there's no pain, there's no problem. Pain is not always a signal when it comes to prostate disease. Prostate cancer in particular often develops silently, with no pain at all in its early stages. Waiting for pain before seeing a doctor is a mistake. By the time pain shows up, conditions can be more advanced. Regular checkups are about staying ahead, not waiting for trouble. So let's put all of this together. Prostate health is surrounded by myths about lifestyle, about symptoms, and especially about medical treatment. These myths create fear, shame, and hesitation. But the truth is much more hopeful. Not every urinary problem means cancer. Not every diagnosis means disaster. Not every treatment means losing quality of life. And not every step forward has to be painful. If you take away just one thing, let it be this: knowledge is power. When you break the myths and learn the facts, you take back control over your health and your future. Don't let fear or misinformation decide for you. Talk to your doctor, ask questions, and make decisions with confidence. And if this video has helped clear up some of your doubts, don't keep it to yourself. Hit the like button, subscribe to the channel, and share this with a friend, a brother, or anyone you care about who's over 50. The more men we reach, the fewer myths will hold us back. Stay strong, stay informed, and keep taking steps towards a healthier future.